So today we're going to be talking about the male reproductive system. It's not a terribly long chapter, but there are a number of medical terms kind of associated with it. Guys, obviously you have an advantage in this chapter because you know your own anatomy probably better than a female. But don't worry, when we get to the female reproductive system, the girls will get an advantage, so it's kind of a wash when we get to the test. First up, we're going to go through all of the different organs and structures of the male reproductive system, and kind of once we have an understanding of what everything is, where it is, and what it does, then we will talk about the medical terms that we associate with each of those structures. When you ask yourself what is the function of the male reproductive system, usually everyone can come up with it's for reproduction, so producing, sustaining, and transporting sperm, which will then, lead to successful reproduction. But another main necessity for men is that it produces and secretes the hormone testosterone. And that's kind of the one that most people don't necessarily think of off the top of your head. And that testosterone is really what gives males the, develops the organs in the male reproductive system and also gives secondary sex characteristics like facial hair, for example. In terms of organs, there are both internal and external organs for the male reproductive system. Externally, obviously, there is the penis, which is the major component, and the penis is considered part of the urinary system, if we remember back to the last chapter, as well as the reproductive system. So is the urethra, which we'll talk about again in a little bit. We also have the scrotum, which in itself is just the sac that contains the testes or testicles, as well as the very initial section of the vas deferens, which is a structure we'll talk about in a little bit. Internally, there's a number of different structures. Most of the vas deferens is located internally, and the vas deferens are basically just a tiny tube that leads from the testicle all the way through up and around the bladder, and then that transports the sperm that will then be, taken out through the penis to then lead to reproduction. We also have something called seminal vesicles, and the seminal vesicles are what contribute to what is called semen. So semen's going to have both your sperm, it's also going to have these fluids that come out of the seminal vesicles, and we also have something called the prostate gland here. The prostate gland kind of surrounds the urethra. It's a ball-like structure, and the prostate gland's job is to secrete additional fluid to aid in the movement of the sperm and ejaculation. So this is one of those glands that's really only in men, and it helps to add to the semen and giving the sperm motility. And we're going to find a lot of issues with the prostate in terms of male medical conditions. Just as a review, the testis or singular testicle is basically the main sex organ for males in addition to the penis. There are two oval-shaped, structures in a sac that we learned was the scrotum. And the job here of the testicles is to produce sperm cells, but the testicles also are responsible for producing testosterone. The sperm itself is also called spermatozoon. It's the male microscopic germ cell, if you remember from biology class, germ cells, which is the male counterpart to the unfertilized eggs in a female. Those are germ cells as well. So those two would unite and produce what we call a zygote, which is the fancy way of saying a fertilized egg. that then grows up and becomes an embryo and a fetus and eventually a baby. And we're going to learn about that later in chapter 9. Testosterone is the principal male sex hormone. This is the one that is responsible for really developing the male reproductive organs, as well as the secondary sex characteristics like facial hair. Next up, we have the epididymis, and this is a small little coiled tube that sits on top of each testicle, so males have 2 of them, and their job is basically to house the mature sperm. So once the sperm is made in the testicle, it's going to sit there in the epididymis, and when the male ejaculates and the sperm is ready to go, it helps transmit that sperm to where it needs to be. And it's acting kind of as a store connector between the testicle and then the vas deferens, which is the tube that will carry the sperm out of the male. And that tube, again, is called the vas deferens. It's also called the seminal duct or the ductus deferens. All of those words can be kind of used interchangeably. It's basically just a really skinny long hose. And as you can see in the picture, it stretches up from the testicle, goes all the way up, and actually goes across the top of the bladder and then comes back down again. And it carries the sperm from the epididymis to the urethra. And remember from the last chapter, the urethra was the tube connecting the bladder to the outside of the body. And we learned that that tube goes from the bladder all the way through the center and out the penis. Well, that's where semen comes out too. So the vas deferens actually connect all the way to the urethra, but so does the bladder. So that one tube from the urethra on actually carries both urine and semen. And there's this little tiny muscle that contracts to prevent any urine coming out of the bladder during intercourse. That way you don't get a combination of both. It's one or the other. The next 2 structures are really to combine with the sperm itself to make the fluid known as semen. The first is seminal vesicles. It kind of looks like a little peanut that sits next to the bladder or posteriorly to the bladder, and from the vas deferens, the sperm goes through this area, and that's where an additional thick fluid is secreted, and that combined with the sperm helps to make semen. And then we also have something called the prostate gland that encircles part of the urethra. So it's kind of an interesting gland in that it encircles the urethra, and its job is to secrete a separate fluid that helps the sperm move and in the process of ejaculation. Because biologically speaking, it would be beneficial for the sperm to be able to, be mobile and to have successful reproduction. Other key terms to note, obviously I'm guessing you all know what a penis is, the male organ for both urination and intercourse, which the medical term for intercourse is coitus. We also have something called the glans penis, which is basically the tip or the enlarged section at the end of the penis. There's also a prepuce, most commonly called the foreskin. It's a little fold of skin that would go over the tip or the glans penis in uncircumcised males. If a male has been circumcised, that is the portion that gets cut off. And really, there's no necessity to have that foreskin. If it's cut off, guys, you live a fully happy, healthy life as well. It's just kind of an extra protection to have that on there. And then semen is the combination of sperm and the fluids that come from the seminal vesicles and the prostate gland and various secretions that substance cumulatively is known as semen. This flowchart and picture is just to show you, where is the sperm starting and ending in the male reproductive structure. So it starts in the testicles itself, then is stored in the epididymis, then it will travel through the vas deferens and the seminal vesicles, where it will connect to the urethra, and then it will go through the prostate gland, then through the penis, and eventually out of the body. Now we're actually to the point where we can do male anatomical medical terms that go with the anatomy we just talked about. There's not a lot of terms, but some of them are not very intuitive or go with the actual name of the structure it's talking about. For example, balano is referencing the glans penis. So if there's a condition specifically affecting the tip of the penis, we would use balano, and we'll see that once or twice later on. Epididymo is for the epididymis, that storage area on the top of the testicles for sperm. Orchido, orchio, orco, and testo all reference testis or testicles. Obviously, testo is kind of the easiest one to remember off the top of your head when you're creating medical terms, but orchido, orchio, and orco are often used in real medical practice. Again, they're going to be used interchangeably, so if you do have to make up your own medical terms, as long as you use one of those, you're fine. Prostato, obviously prostate gland. Vaso is used here for vessel or duct. I want to emphasize that vaso is one of those generic medical terms that could really mean any vessel or any duct throughout the body, but here obviously we're specifically talking about the male reproductive system. And then vesiculo is specifically talking about the seminal vesicle area of the male reproductive system. A few other terms that we're going to be using here. Andro is the combining form for male. So when we're talking about male-centered conditions that obviously would not affect a female, we would use andro. Spermo and spermato both mean sperm or spermatozoan, either one. And then we have a suffix, ism. Ism means a state of, and I think we've seen this before in previous chapters, but there's a lot of medical conditions where there is a state of something, and we're going to see that again in a slide or two. Okay, back to another kind of health class picture here. This is what a sperm looks like. Sperm and spermatozoan are two words that can be used interchangeably. There's a head portion and kind of a little neck area where there are tons and tons of mitochondria, and then a tail. So the nucleus is in the head, and that's kind of where all the genetic material is located. In that mid piece where there's tons and tons of mitochondria, if you remember, the mitochondria is the powerhouse of the cell. So it's basically the battery powering the sperm so that they can, swim that great distance to try to hunt for the egg. And then there's the tail, which actually, is doing that moving to help the sperm swim around. And just kind of as an interesting note, in a normal ejaculation, there's somewhere between 300 and 500 million sperm. And then eventually, in theory, one of them, the special sperm, makes it to the egg, and that's how people get born. Orchido, orchio, orco, and testo are all combining forms for testis or testicle. True or false? Hopefully you say true. And I do want to point out here that testo is really only used in one medical term, testitis, so inflammation of the testicles. Otherwise, we're going to be seeing the other ones more often than not. Here are all the diseases and disorders that are built from word parts, and most of them involve itis as a suffix. So inflammation of various parts of the male reproductive system is the most common issue. So we have balanitis, which would be inflammation of the glans penis or that tip area of the penis. We have epididymitis, so inflammation of the epididymis. You can have inflammation of more than one area. For example, orchiepididymitis. So that would be inflammation of the testicle and the epididymis. Just the testicles could be orchitis, orchiditis, or testitis. All of those are equally correct. Prostatitis would be prostate. Prostatocystitis, if we remember, cysto is a combining form that we learned a while back. It means bladder. So that would be inflammation of both the prostate and the bladder. And prostatovesiculitis would be prostate and seminal vesicles. Other conditions on here, we have anorgasm. So we have ism, which we learned previously is a state of. An means absence. So here we have a state of absence of testes or testicles. And this could be unilateral, meaning one, or bilateral, meaning both. And in this condition, the male is missing one or both testicles. Balanoria, if we remember, rhea means discharge. It's not necessarily specifying what is being charged, but it's just telling you that in this case, in balanoria, there is some kind of discharge coming out of the glans penis. Whether it's pus or blood or whatever, it doesn't specify. We have benign prostatic hyperplasia, abbreviated BPH. And in this case, if we remember, benign means non-cancerous. So it's some kind of usually a tumorous growth, but yet it's non-cancerous at this point. Prostatic means that it's affecting or pertaining to the prostate. And then hyperplasia is a word we learned way back at the beginning. It means overdevelopment. So in layman's terms, you have overdevelopment of a growth on the prostate gland, and that can then, lead to subsequent issues. The next term, cryptorchism. So we have ism, so a state of. Crypt, or it could be crypto, but because orchido starts with an O, we don't have two O's here. It means a state of hidden testicles. And again, this could be one or both testicles. And in this condition, really what it means is that the testicles have not descended. During fetal development, the testicles are located, up in the abdomen actually by the kidneys. And then eventually they descend into the scrotal sac before birth. And if those, testicles have not dropped, as they say, then you would have the condition of cryptorchism. Other conditions on here that are not inflammation is prostatolith. Lith means stone. We saw this when we talked about gallstones and kidney stones. Here we have a stone in the prostate. We also have prostaturia. So we have discharge coming from the prostate. A key thing to note here is discharge doesn't necessarily have to be, coming out of the body. And most of the times when we talk about rhea, it is, exiting the body in some way from your ear or your nose or the glans penis, for example. But it can also be internally, such as the prostate. Okay, I think that's all the terms on this list. Take a moment and try exercise 9 just to kind of get all of these straight, and then we'll move on to the ones that are not built from word parts. Here's the cartoon example of what benign prostatic hyperplasia looks like. Again, this is where you have excessive development of prostatic tissue on the prostate, most likely some kind of non-malignant tumor cells growing. And what that does is it kind of creates this mass on the prostate. And the reason that there's an issue here is that the prostate normally encircles the urethra, which carries the urine from the bladder out of the body. And if you can imagine that little tube gets kind of pinched off when the prostate gets larger. And so it creates issues when someone's trying to go to the bathroom because it cannot, empty out of the bladder as it normally would. So it can interfere with passage of urine. So it can affect, your frequency of urination. It can give you, bedwetting. It can cause you to retain too much urine, and so on and so forth. So that's why the prostate can cause a lot of issues when it becomes enlarged. Now we're to the diseases and disorders that are not built from word parts. So the first one I'm pretty sure everyone's heard of, erectile dysfunction, or ED. You've probably all seen several commercials for Viagra and whatnot targeting ED sufferers. It's also called impotence, and really what happens is just the male cannot attain or maintain an erection for a sufficient amount of time to successfully perform intercourse. The next term here is a hydrocele. Hydro means water, and in this case we have an abnormal collection of fluid in the scrotal area. So if we remember, the scrotum is the sac that holds the testicles, and kind of the epididymis in the very beginning of that vas deferens where the semen, where the sperm travels out of the epididymis. And in this case, in a hydrocele, there is some kind of fluid buildup in that scrotum area. So it can put excess pressure on the testicles and cause, a lot of pain. The next term is phimosis. And phimosis is a surgical tightening of the prepuce, which is that foreskin. Again, the foreskin is basically, a little flap of skin that stays over the glans penis normally, and then during an erection it kind of folds back or peels back, exposing the glans penis. And if for some reason there's kind of extra tightness and that foreskin can't retract back, then you have phimosis. And this can either be a congenital issue, or if you had balanitis or some kind of, infection, then it might not retract. The surgical intervention for this would just be performing a circumcision. You basically cut off the foreskin, so then phimosis would never be an issue. The following term is priapism, and priapism is when you have an erection that lasts way longer than it's supposed to, accompanied with pain and tenderness. It's kind of like those, Viagra commercials where it says, if you've had an erection for longer than 4 hours, call someone for help. That kind of thing. Usually it's kind of a blood flow issue, but it can be extremely painful for a male to sustain an erection for extended periods of time. The following term is prostate cancer. We also have testicular cancer on this list as well, but it's, cancer of those respected areas. And usually prostate cancer is for middle-aged men or slightly older men, whereas testicular cancer is usually in men between 15 and 35, so it's kind of a younger man's cancer. Another term is spermatocele. In this case, the scrotum is swelling because there is fluid collecting in the epididymis. And in the sperm cell area, there can also be an excess collection of sperm cells. but the result here is the same. There's a swelling in the scrotum that can lead to extreme pain. The last term on the list I'll mention now is a varicocele, so it's the last kind of seal, and this is where there are enlarged veins in the spermatic cord. There's a picture of it in your book on page 266, but basically what it is the spermatic cord serves as a blood supply. There are veins that go down to the testicles to, feed it blood as it produces sperm. And for some reason, those veins have become enlarged, and that can be called a varicocele. And the final term here is testicular torsion. Again, this has to do with the testicles, but torsion has to do with like a torque or a turn. And in your book, it mentions that this is basically a twisting of the spermatic cord. And when the spermatic cords, or the veins that run down to the testicles, get kind of pinched or twisted in some way, well, then that cuts off blood flow to the testicles. Kind of a big deal. So it's considered kind of a surgical emergency because you need to restore that blood flow. But this often happens during puberty, and it obviously is very, very painful, but it can be easily remedied. At this point, take a moment, work on exercise 13. It's kind of some matching just to keep you on track with the medical terms and their definitions. Here's a cartoon image of what that hydrocele and a varicocele looks like. So if you remember, the hydrocele is when there's some kind of fluid buildup in the scrotum area, and it can, cause inflammation, and it can also cause a lot of pressure and pain on the testicle area. On the right, you have the varicocele, where the spermatic cord, those veins that lead down to the testicles, become enlarged in some way and can also be extremely painful. Which of these terms means discharge from the prostate gland? Phimosis, hydrocele, prostaturia, or prostatitis. Looking at these terms, you should instantly know what the suffix for discharge is, and that's ria. Alternatively, prostate gland is prostato, so you should have been at least able to narrow down to C and D, but the correct answer is C. We are now to the surgical terms. Most of these surgical terms have to do with incisions or removals. So we're going to see a lot of tomy and ectomy suffixes here. But we also have plasty, meaning surgical repair. So the first term is a balanoplasty, which is surgical repair of the glans penis. Then we have epididectomy. So here you are removing the epididymis. We have orchidectomy or orchiectomy. Those are going to be used interchangeably. You could technically also do testectomy, although that one's not really used in common medical practice. This is removal of a testicle. This could be pertaining to one testicle. However, if you remove both testicles, that's also considered castration. That's another medical term for that procedure. Next, we have orchidopexy or orchiopexy. And this is surgical fixation of a testicle. This would be a surgical procedure that's most often performed for someone who has cryptorchism or hidden testicles, those individuals who have a testicle or two that have not descended into correct anatomical place. Orchidotomy and orchiotomy means you are inserting or making an incision into the testicle. Orchioplasty means that you are doing some kind of surgical repair on a testicle. Prostatectomy, removal of the prostate, fairly straightforward. Next we have prostatocystotomy. So just like other medical terms, we can link several structures together. Here we have the prostate and the bladder together in prostatocystotomy. So you're making an incision into both areas. Prostatolithotomy. Here we are making an incision with the purpose of removing a stone from the prostate. That's why there's that lith in the middle. The next is prostatовesiculectomy. So it's an ectomy. You are removing, in this case, both the prostate and the seminal vesicles. The next term, vasectomy, most of you may have heard of what a vasectomy is, but it means removal of the duct, or basically it's a removal of a duct. In this case, we are talking about the vas deferens, and this is the surgical procedure that men have performed to make them sterile or no longer able to have children. Basically, you just remove a section of the vas deferens, and I'll show you what that looks like on the next slide. Kind of going along with that, we have a vasovasostomy, and the vasovasostomy is the creation of an artificial opening in the vas deferens. And that procedure is a surgical procedure that is used to try and reverse or undo a vasectomy. And the last one here is a vesiculectomy, and that's where you're removing a seminal vesicle. Take a moment here, work on exercise 16, maybe look at the vasectomy image on the next slide, and then we'll do surgical terms not from word parts. Here's exactly kind of what a vasectomy looks like. So in the first part of the procedure, an incision is made into the covering of the vas, which is kind of an outer cover to the vas deferens themselves. Then the vas is exposed, and they basically hook a little piece of it out, and then they, cut off a small section of the vas deferens, and then they kind of just stitch up the two ends, and voila, you basically have two pipes that are missing a section. So the sperm, even though it's still being produced in the testicle and stored in the epididymis, it has no way to continue up the vas deferens. It's a dead end now. And it's important to note that this procedure can be successfully reversed most of the time. It's not 100% effective to reverse this, but it is possible. And basically, they do a vasovasostomy. They go in and they basically stitch up the two severed pieces of the vas deferens and kind of restoring that highway for the sperm to travel upon. Again, it's not 100% effective, but it's something that a male can do to reverse their sterility. We're going to talk about female anatomy in the next chapter, but this vasectomy is basically the least invasive, least painful, and probably most cost-effective way for a couple to, biologically no longer have children. And in a female, there's nothing that's reversible, so that's another advantage for the male to get the snip-snip, as it's called. Here we have the surgical terms not built from word parts, and some of them are fairly easy. Most of them all have to do with the prostate, but you'll notice the last few terms are quite lengthy, which is why they are abbreviated. The first term here is circumcision. Most of you have heard what this is before. It's the surgical removal of the prepuce, that foreskin of the penis. Your book has a picture of it, and I have a picture kind of it in cartoon form on the next slide. Then we have a hydrocelectomy, so removal of the fluid that would be in the scrotum area to kind of alleviate that pain. This is usually done with the insertion of a big needle, and they just suck out the fluid buildup. And then all of the rest of these terms have to deal with prostate. So a radical prostatectomy, this is something that's most often done with prostate cancer patients, and it's called a radical prostatectomy because they remove so many things. So it's the prostate gland, oftentimes also the seminal vesicles and parts of the vas deferens, and maybe even other things in an effort to treat prostate cancer. The next is suprapubic prostatectomy. So this suprapubic meaning pertaining to above the pubis. And what they do in this case is just kind of make an incision in the abdomen and through the bladder. And they use those two tiny incisions to remove pieces of the prostate. And this is one of the procedures that's usually used to treat benign prostatic hyperplasia. So where you have that excessive development of the prostate that is non-cancerous at this point. The next term, transurethral incision of the prostate gland. And you'll see transurethral in the following three terms. And what that means is pertaining to through the urethra, which, sorry men, basically that means something is inserted through the penis and through the urethra to get where they need to be with the prostate. So transurethral incision of the prostate gland, or TUIP as it's called. Here they just kind of make a few little incisions in the bladder and in the prostate gland. Nothing is removed here, but they do that to try to widen the urethra if the prostate is somehow pinching on their urethra in an effort to revive proper urination. They might do that procedure. Alternatively, we have transurethral microwave therapy. So again, you're still sticking something up through the urethra area. Here, you're basically sending off microwaves in an effort to treat prostate cancer, benign prostate hyperplasia here, to try to break up those cells or destroy excess growth in cells using microwaves. And the final one, transurethral resection of the prostate gland. Here, they're removing parts of the prostate, but instead of doing it suprapubically, kind of through the two incisions in the abdomen, they're doing it transurethrally. So they're basically taking little snippets and then pulling them out through the urethra area. I know, guys, that makes you want to cringe thinking about all of those procedures that can be done. Take a moment now and then work on exercise 20 on page 274. The book also has really good pictures or cartoon images of what these procedures might look like in cartoon fashion. So here's a picture of what circumcision looks like. Again, they cut off the prepuce, or that foreskin area, and they might remove just part of it or all of it. And then wherever they cut, they then stitch it to the kind of end of the glans penis area, or the end of that tip area. And then, you know, those stitches heal over time, and then it all heals over, and voila. That's why they typically do this in infants, because they will never remember. However, you know, teenagers and adults, you can get circumcised at any age. Obviously, you will feel it and remember it a little differently if you're older. Here's an example of a laparoscopic prostatectomy. Laparoscopic, if we remember, references the abdomen. So in this case, there is a laparoscope, which is inserted in through an incision into the abdomen. There's also instruments inserted in two other areas in this picture. And then using those incision areas, they try to do as much as they can with a minimal amount of cutting a person open. Here they are doing a radical prostatectomy where they try to tackle prostate cancer or the early stages of prostate cancer in this particular area. This is a suprapubic prostatectomy, and this is considered a large incision surgery. As you can see, they basically made a cut above the pubis area in the person's abdomen and resected it or pulled it apart, and the doctor can then have access into the bladder area in an effort to get to the prostate. And the doctor in this case is sticking his hand in and removing a chunk of the prostate or a mass on the prostate to allow for proper urination from the bladder through the urethra that runs through the middle of the prostate. Here we have transurethral resection. As you can see, the transurethral part is stuck through the urethra of the male, and it's something called a resectoscope, meaning that it's going to take or pull out part of what it needs. Here it's just inserted in and is basically going to corral and take little bits of the prostate gland and then pull it out through the urethra in an effort to treat urination issues, most likely. Which of the following is surgical removal of the foreskin of the penis? You have a vasectomy, vesiculectomy, circumcision, or hydrocelectomy. Well, all of these are removal. Some of them are from ward parts and some are not, but in this case the correct answer is C, circumcision. There are a few diagnostic terms not built from ward parts. We have diagnostic imaging term, lab term, and then a procedure. So the diagnostic imaging is a transrectal ultrasound, or TRUS, and basically it is an ultrasound, but what they do is that they put a transducer probe in through the rectum, which is the transrectal part, and then sound waves are emitted, and that creates this ultrasound that's used to diagnose prostate cancer. Lab results, we have a prostate-specific antigen, and this is a blood test that basically measures that antigen in the blood, and if it's elevated, then it can be an indicator for prostate cancer or some kind of prostate infection or tissue, indicate benign prostatic hyperplasia or prostatitis or other conditions that are affecting the prostate. There's also something called a semen analysis. So this is where they basically put the semen under a microscope and look at the semen. They, assess the size, the structure, the movement of the sperm. And they do this to evaluate male infertility and to determine whether or not a vasectomy was effective. This is also called a sperm count or a sperm test. So again, any couple who might be having trouble conceiving a child, this is a test they might do to figure out if the issue is kind of the male's problem in terms of sperm. And it's also an indicator after someone had a vasectomy to try to get themselves sterilized to make sure that it was truly effective. There shouldn't be, happy, healthy swimmers in the ejaculate of a male. The final term here, digital rectal exam, DRE. This is typically what they just call the prostate exam. This is the exam that guys, start to get when they turn, 40, I think is the magic number. But it's basically the physical exam where the guy has to bend over and the doctor inserts a finger into the rectum and then they can feel for the size and shape of the prostate gland. And that gives them an indicator for all kinds of prostate issues. And that's a particular exam that men starting at 40 then get every so many years as they get older to continue to monitor their prostate. There are a few complementary terms built from word parts. So these are terms that are going to be used with the male reproductive system. The first of which is andropathy. This is just a generic term that means a disease of the male. So it could be anything that is, male-oriented, and that really reflects any condition that's part of the male reproductive system. We have aspermia and oligospermia. Aspermia means that you have no sperm, or meaning that you have no sperm in the semen that you produce, or it's possible you have no semen or no ejaculation whatsoever. And so one example would be after a vasectomy, you would no longer have any sperm in the ejaculation. We also have oligospermia, which oligo means a few or scanty. So in this case, there is too few sperm in the semen or ejaculate, and that could, contribute to infertility, for example, because there are not enough sperm to actually have the one survivor make it all the way to the egg. Finally is spermatolysis. Lysis means dissolution or to destroy or break up of sperm. If you think of different forms of contraception, one of them is spermaticide, and that basically does exactly what this is, spermatolysis. It causes the sperm to basically explode. You can also have autoimmune responses where your body might attack sperm cells as well. Now we're to the complementary terms not built from word parts. And you'll probably notice that we have some sexually transmitted diseases here. For some reason, the authors decided to lump all of the STDs in with the male reproductive system. Sorry, men. The first of which we have is acquired immunodeficiency syndrome, or AIDS, and that's obviously an advanced chronic immune disorder. So it has to do with the human immune system's inability to fight off infection. And there are various ways to get this, but basically what happens is the individuals can no longer fight off simple, easy diseases and disorders that we can get, and that will eventually lead to their demise. Next, we have artificial insemination. So this is any way in which semen is introduced into a female by artificial means. There are various ways to do this, but typically done when someone is, or a couple is having trouble trying to get pregnant, and they do, in vitro fertilization, for example, or artificial insemination to try to get the female pregnant. Azoospermia is where there is a lack of live sperm in the semen. So there's sperm, so it's not azoospermia, but they are not alive. So the male is ejaculating dead sperm in the semen, and this could be either the result of an infection or possibly blocked vessels or ducts that have led to the death of the sperm. The first STD is chlamydia, called the silent STD. It's caused by a bacteria, C. trichomatis, and It's called the silent STD because you kind of have it and don't even realize you have it. But it has symptoms including, painful urination, discharge from the penis, genital itching. It can cause vaginal discharge in females, and excess bleeding in females as well. The next term is coitus. We saw that on a previous slide. That's the fancy medical term for intercourse. I'm going to assume you all know what a condom is, and I'm going to assume you all know what ejaculation is. Next we have genital herpes. This is caused by the herpes simplex virus, and I think we learned previously that the herpes virus can cause a number of different things, one of which is cold sores. Here we're going to say genital herpes. Gonorrhea is caused by another bacteria that in this case inflames the mucous membranes of the genitourinary tract. So basically the lining of the genitals and the urinary tract, so the urethra for example, become infected and inflamed, and that's what makes gonorrhea painful. Now we have human immunodeficiency virus, or HIV. This is considered a sexually transmitted disease that's caused by a retrovirus, and this virus can then, progress into or turn into AIDS because it causes the immune system to basically kind of shut down. Then we have human papillomavirus. This is a sexually transmitted disease caused by a virus as well. There are more than 40 different types of HPV, and it could cause, just growth. It could be cancerous. It also causes genital warts or venereal warts in men and women, but it also can cause cervical cancer in women, which is why you see the vaccine now developed fairly recently for HPV. But guys, it's important to know that yes, there's a vaccine to prevent cervical cancer for the HPV virus, but males should get this HPV vaccine too because it can protect against genital warts, which is something I can imagine none of you men would want. Next, infertility just means that you are having a hard time or an inability to become pregnant or get someone pregnant. And the, measure for that usually is if you're having more than 1 year of trouble trying to have a child, then you're considered in the infertility category. Orgasm, you all know what that is. Puberty, you've all started or gone through it already. Basically, this is the period of time where you guys are all moody. But anatomically, it's where the secondary sex characteristics begin to develop, and you can actually begin to be able to successfully sexually reproduce. Sexually transmitted disease is just any disease that is given from one person to another via sexual intercourse. And these are also called venereal diseases. It means the same thing. Sterilization is a surgical procedure in which an individual can no longer reproduce. So in this chapter we learned a vasectomy is one way to do that for a male. There's a few different ways to do that we'll learn about for a female in the next chapter. Syphilis is another type of bacterial infection, in this case from a bacteria called Treponema pallidum. And in this case, if left untreated, it can progress through several different stages, and it can also spread to other areas of the body. Syphilis is one of those ones that can be treated with a shot or a string of antibiotics. And trichomoniasis is a one-cell organism, trichomonas, and it infects the genitourinary tract, so the urethra, for example, and can cause all kinds of issues like urethritis, enlarged prostate. In women, it can cause vaginal issues as well. So it kind of goes along with chlamydia in some of the symptoms that occur. Okay, that was a ton of complementary terms, and I would suggest working on exercise 31 and 32 on page 281 to get these straight, especially the STDs. They're kind of hard to keep straight in the level of detail that this book goes in. It really doesn't go into a whole lot of detail, so it can be tricky in keeping some of them straight. Here's just a compiled list for the specifically sexually transmitted diseases, but all of these were covered when I just talked in the last slide about the complementary terms, not built from word parts. Here's an example of what syphilis looks like. Again, the microscopic organism is pictured in A. Treponemion pallidum is the specific organism. And then you can see some of the results, B on the penis, and then C, it shows you what it can look like in other areas of the body, such as this rash on the hands. Last but not least, we hit up the abbreviations at the end of the chapter. All of these we had in the slides leading up to this point. You will be responsible for knowing all of these terms. Notice the last few on this list, all of those T terms for trans, or TU for transurethral. Those are all those surgical procedures that we talked about before. But please work through exercise 34 so you do know what the full-length words are for these abbreviations. You will be responsible for, example, if I give you the abbreviation, you give me the long word version, or vice versa. Which of the following is an STD? Orgasm, digital rectal exam, coitus, or chlamydia? Hopefully you all know that STD is a sexually transmitted disease. So the only one on this list that is a disease is D, chlamydia. As indicated before, at the end of the chapter, they always have these kind of medical records and real-world application sections where they put all the different words together in one or two medical documents. So please take some time and try to read through this. There's a number of vocabulary words that are underlined. You should be able to understand what those underlined words mean. And also note that several of these are not even from this chapter, but have actually been used in previous chapters. So you should be able to remember what those also mean. So read through it. You should be able to pronounce it, these underlined words, as well as define them. There's additional resources like this on the Evolve website, so please make sure that you take advantage of that as well.